So the way Invisalign works is we take a scan of your mouth. We get an accurate impression of what your mouth would look like. We send it off to the lab, and the lab will do an animated model of what your before and after ideal positioning of teeth would be like. And we come up with a treatment plan which involves multiple aligners. Aligners are clear trays that are meant to fit onto your teeth. Now, every 2 weeks, 1 to 2 weeks, you guys change your aligners. The shape of the aligner keeps changing. So every 1 to 2 weeks, you change the aligner. And as the shape of the aligners keep changing, it applies pressure on certain teeth in a certain direction, which with continued force and continuous wearing, your teeth actually end up following that path and your teeth end up moving. So it's kind of like wires. They pull and push in a certain way, but the aligner dictates the position of your teeth. And with continuous wear and going through the series of aligners, you get to that final end product that you are super happy about. Of course it can. Now with everything, like everything else, everything has its limitations, pros and cons. But Invisalign actually does work really well at closing spaces. Now different people have different amounts of space. So we need to figure out how much space you have and how much tooth we need to do to close that space. Sometimes it's a combination of doing cosmetic work with veneers or crowns along with Invisalign, but oftentimes, depending on the spacing again, closing spacing is actually quite nice and done quite nicely with Invisalign. So let's talk about the difference between Invisalign versus braces. Braces, everyone knows, growing up, you get these metal brackets on your teeth, you get like a little wire and you go in and you change the elastics, and it's constantly, you cannot floss in between your teeth. There's metal sticking out, it cuts your cheeks, it cuts your gums. Sometimes, especially at the beginning of treatment, you feel a lot of pressure, there's a lot of tightness on your teeth. Compared to that, we'll talk about why someone would choose Invisalign. Now, not every patient is the same, and not all the mouths are the same. So there's definitely certain situations where you one over the other. However, it's like getting to point B. So if I want to get to the airport, I could take a Toyota Corolla or I could take a Honda Civic. I'm not saying which is which, but they both get you to the end destination. It depends on how you want to get there. So the biggest advantage of Invisalign is that you are in control. So let's say I have a wedding to go to next weekend and I'm doing Invisalign, I'm trying to fix my teeth. The world doesn't need to see that. I can walk around with nothing. I can eat like normal. I can floss like normal. I'm basically in control of my treatment. There's nothing cutting into my cheek. It's not uncomfortable. I sleep with them in. I do everything with them in. I'm wearing these aligners all the time. They feel relatively normal. Yes, I feel the pressure, but it's not the same kind of pain that you go through when you've had orthodontic braces. But yeah, so I think one of the main things is hygiene is a lot easier. Aesthetically, they look a lot nicer. I mean, like I said, they both get you to the final destination. It's just how you want to get there.